Hi, it's September is Pain Awareness Month. My name's Dr. Alana, and I have a particular interest in pain management in animals. So in our last video, we talked about the three major myths, that they're not going to cry when they hurt. If they're limping, it means it's sore, and that the type of behavior that we see may or may not correlate with the actual site of pain that the animal has. In this video, I'm just going to go through a few more subtle signs of pain that I want you to be looking out for in your pets at home. So, a lot of the signs of pain actually overlap with anxiety. And so it can be really tricky sometimes to initially know. And we know that pain itself can cause anxiety. And so if we're not sure, we may well give your animal a pain treatment trial. So giving them some pain relief to establish whether or not that is actually what the source of the issue is. So things like panting, that can be a sign of pain or anxiety. A change in their social interaction. So they may either become Velcro animals and follow you into the toilet all the time, or they may actually withdraw from the social interaction that they once used to have and hide away. Their changes in their general sort of play may change. Overall movement may actually increase. Some dogs will just pace a lot if they can't get comfortable. And cats and dogs often will become less active if they're painful because, again, they stop doing things that hurt. That's the number one sign of pain, is that they just stop doing something because it hurts. You may also see changes in their facial expression. So particularly like bulging eyes. We call it a whale eye. And you can see the whites of their eyes, just like you can see mine. Often off the side eye, you'll get a bit of that. Or they can get sort of an over-focused 100-yard stare, and they'll just stare at something. Those can be some of those subtle signs. So if you're seeing any of those signs of anxiety, it may actually be pain. The next more subtle sign is a change in toileting behavior. This may not mean that they're actually having accidents, but they may be changing the way they stand when they urinate or defecate. They may not want to go through the dog door and utilize that. If a cat is using a litter pan as they get older and get arthritic, they may struggle to get into the litter pan and choose to instead wee or poo next to the litter pan, or they may only use it for one of those things but not both forms of elimination. So changes in those toileting behaviors also can be a bit of a red flag for us to investigate. Changes in appetite also can be as well. So particularly if they have to sort of put their head down to reach a food bowl. If they've got pain in their neck and shoulders or their back, that might really cause a struggle for them. And so that can affect their appetite. Again, and if their dental disease or oral pain is really, really severe, you may start to see a change in appetite. But just because they're eating does not mean everything is great. Again, that will to survive will often overcome dental pain because it's I either eat through the pain or I starve to death. What are my choices? So something that might be a little bit more obvious is guarding an area, licking it, chewing it, or even staring at it. So if there's something that is particularly sore, they may you may see those sorts of behaviors. Okay. In the next video, I'll also have a quick chat about some specific things to cats, because cats are not small dogs and they have their own sort of issues with pain and can manifest different things as well. If you have a pet that you think is in pain at home, please let us know. There is so much that we can do these days, and it is a passion for us to be providing the best possible quality of life for your pet. So give us a call, let us know how we can give you a hand. Thanks.